Okay, so we're gonna put barriers on and take them back off. Okay, so the first thing you need to start out by doing is washing your hands, making sure that you have clean hands. It's okay to touch clean barriers with bare hands as long as they're clean hands. OSHA says that you absolutely have to wash your hands when you come into work, before you go to lunch, before you come back from lunch, and before you leave for work, as well as anytime after the bathroom. And then they say that it's okay at other times to use hand sanitizer, but you have to clean your hands in between each patient, in between each procedure. So we're going to wash our hands. I'm going to wash my glasses at the same time. Okay. Make sure that you just scrub really well. And then I'm going to clean my glasses too here. Make sure to get your hands pretty dry because you're going to be putting gloves on in a minute, especially when you're doing this all the time, and it's really tough to get gloves on with wet hands. Okay, now that I have clean hands, we can put on our clean barriers. So our barriers include a chair cover every single time. The chair cover gets changed in between each and every patient, no exceptions. And we also have tape. The tape goes over any surface that is either touched often by dirty hands or difficult to clean. So some things we can't spray with the cabicide, so any of those things would need a barrier. I can get it. So the light. Here we go. The light can't be sprayed, so we put it on the candles. And the light switch. Make sure when you're doing this part that you leave these flat and open like this. This is a sign to others that they're clean. When you grab and put it on like this is a sign to others that it's dirty. So if you have clean barriers and you're leaving them in the room, you want to leave it flat like this. You don't want to leave it all grabbed up like that. Okay, buttons that are used often. Okay, you're going to be using a computer mouse, or maybe if you're going to be typing, some of the hygienists have to type. One of the most easily forgotten ones is the light, or the X-ray button. So you want to put it on the X-ray button and make sure that you come back out here when you're done and you take it back off, okay?
Just take some of the pressure off there and distribute some of the pressure.
Anything else you think you might touch? If you're going to touch the light switch, if you're going to touch a cabinet, anything like that, you would want to put a plastic barrier on. Right? So that's how we put them on. So once they're dirty, we're going to need our PPE to take them off because they're going to be dirty, right? We're going to come in, we're going to don our PPE. So remember a mask with the bendy side on the top for my nose. My glasses, okay? Remember, gloves on last, because we want to keep them clean. Once I touch anything that has been cross-contaminated with these gloves, they're dirty. So if this mouse has been cross-contaminated and touched by somebody else's dirty gloves, any dirty gloves at all, and I touch this, my glove is now officially dirty. I cannot touch anything that I consider clean with this glove. So I'm going to take off all of our barriers. said, don't forget your X-ray switch. Okay, so I have dirty gloves now. I'm going to spray everything. I'm going to use Cavicide. Cavicide is a harmful chemical, okay? If it gets in any of your mucous membranes, it can possibly make you blind. If it gets in your eyes, it'll make you sick if you inhale it or if you ingest it. If it touches your skin, it'll absorb into your skin. It'll dry and crack it. And with enough exposure over time, it can do some seriously harmful things. So you want to make sure that when you're using Cavicide that you are wearing all of your PPE. It may seem like it's okay not to wear your mask or your glasses, but you do not want to inhale this stuff. You do not want it getting into your eyes. So we're going to spray. Okay, this should be a nice soaking spray. Everything should be good and wet. Anything that you've used, these here, the tubing and the hand pieces and all of that, this may seem like something that you shouldn't spray, but it is air and suction powered. It is not electronically powered, okay? Anything that is electronically powered does not get sprayed, all right? I would not spray the light. I would not spray the tube head. I would not spray anything on the computer, anything like that. You do not spray. You don't want to have an electrical shock. Then you get Cavicide wipes. OSHA says the wetter the better, so if it's not dry, it's not working. Sometimes when these get left open, these wipes can dry out a little bit. If you feel like your wipes are a little bit dry, you can always spray them.
Remember, you're coming in with wisdom. Like, this is Disneyland.
Well, drop this on the floor. So if that happens during a procedure, okay, you don't pick it up. You push it to the side, and then when you're ready, you pick it up and you always wipe it down before you put it back. Okay, and you wipe everything. You don't just want to do a quick swipe. You really want to clean. We have all of these little folds, all of this. While your patient is sitting and waiting for you to come back or to get numb, they are looking at this stuff. So make sure that you pay special attention when you're wiping this down. Although we didn't spray the light, I do like to give the handles a quick wipe. But never spray it. Make sure you're checking the base of your chair down here. All of this stuff, okay? Anything that you've touched, anything that's plastic. All right, and then you're going to want to periodically change out your wipes. If you see that they're soiled in any way or dry, get new wipes.
I did go on and look at a GDP price for it to give it a rough estimate.
This gets wiped down. Okay? And then before you set it back down, this gets wiped down. Then you put it back. When it comes to the air-water syringe, you want to make sure that you not only wipe the syringe, but that you wipe the housing for the syringe, because this is dirty. It's going in and out of here, which makes this dirty. So we want to make sure that we really get in there. We don't want to skimp or rush when it comes to wiping our rooms. Making sure that we have a clean environment for our patients is extremely important. So when you're cleaning this, for all of the tubing, you wipe all the way down, okay? Because there's spray aerosols that are getting all over this stuff. And then you want to take in here and you want to make sure that you get all the little crevices. All the way down the tubing. When you're doing the suction, okay, first of all, wipe all of this. Wipe all the way down the tubing. All right, see that? That's what we want to avoid right there. Okay, and then to clean this little handle, you want to make sure that you always turn it on and off so you can get underneath that spot. This little rubber piece right here is not disposable. Please do not throw this out. Turn it on, wipe underneath, and then turn it off. Wipe all the way down the tubing. Okay, the part that people tend to forget the most is the x-ray equipment. So, if you've been taking x-rays, this would be open. The tube head would get wiped down, but it would not get sprayed. Never spray this tube head, please. But you would wipe it down completely. As well as the lead vest. If you have a lead vest to use, the lead vest needs to be put on the chair, spray wipe sprayed, and then hung back up to dry. Okay, and then, this is what everybody always forgets. Make sure that you change the barrier on the x-ray button and that you wipe it. Next, when we take off our PPE, remember gloves, they're dirty now. We do not want to put the germs that are in our gloves in our hair. So, take our gloves off first. Mask in the trash.
Yes, I can.
Then we wash our glasses and our hands, and everything's clean. We replace your barriers.